Good morning, wherever you are. This is Vesper Quill from ConferenceHype. Our segment will focus on liver transplantation for non-resectable colorectal liver metastases, 10-year follow-up and assessment of curative rate in the SECA-II Study. From the 2026 August 10 edition of Annals of Surgery. Background: describe the long-term health-related quality of life after curative intent hepatectomy for high-risk colorectal liver metastases. Methods: this prospective study enrolled patients with resectable CRLM with clinical risk score greater or equal to 3. Results: from 297 consented, 146 were evaluable by completing preoperative and postoperative surveys. Discussion: HRCO-L decreases postoperatively before returning to preoperative levels and exceeding it among patients without recurrence. From the 2026 August 10 edition of Annals of Surgery. Background: traumatic injury affects every age group, payer, and care setting in the United States, yet how injury-related spending distributes across these dimensions has not been comprehensively quantified. Methods: cross-sectional analysis using the Institute for Health Metrics and Evaluations Disease Expenditure Project, which harmonizes over 40 billion claims across Medicare, Medicaid, and commercial payers. Results: U.S. injury spending totaled $106.7 billion in 2022. With 52% occurring outside acute care settings and ambulatory care, nearly equaling inpatient care. Discussion: this first comprehensive, claims-based accounting of the nearly $107 billion spent annually on injuries in the United States reveals distinct spending phenotypes defined by mechanism, demographics, and payer, with direct implications for how trauma systems are planned, financed, and sustained. From the 2026 August 18 edition of Annals of Surgery. Background: Medicare reimburses hospitals through diagnosis-related groups and physicians through current procedural terminology codes, systems that have diverged significantly over time. Methods: DRG and CPT payment data were obtained from the Medicare Inpatient Prospective Payment System and Physician Fee Schedule 2019 to 2023. Results: 2431 DRG-CPT ratio series demonstrated statistically significant increasing trends after BH correction, with no series showing a significant decline. Discussion: significant payment divergence exists between hospitals and physicians across general surgery. From the 2026 August 14 edition of Annals of Surgery. Background: although robot-assisted pancreatidyodnectomy enhances patient recovery, it could be associated with higher costs than open pancreatidyodnectomy, potentially limiting its widespread adoption. Methods: predefined cost-effectiveness analysis in the international randomized DIPLOMA-II trial comparing RPD and OPD in patients with primary resectable neoplasm in 14 centers in 6 European countries. Results: overall, 268 patients were included. Discussion: this analysis in a randomized trial found no significant differences in costs between RPD and OPD up to 6 months. From the 2026 August 19 edition of Annals of Surgery. Background: IAEs are an inherent component of surgical practice, and owing to its complexity, esophagectomy is no exception. Methods: this retrospective observational cohort study analyzed prospectively collected data from consecutive robot-assisted minimally invasive esophagectomy performed at UMC Utrecht using the Da Vinci's eye system. Results: between 2018 and 2025, 478 robot-assisted minimally invasive esophagectomy were performed. Discussion: in this retrospective cohort, over 90% of IAEs during robot-assisted minimally invasive esophagectomy were managed robotically without conversion, with no significant increase in postoperative morbidity. From the 2026 August 10 edition of Annals of Surgery. Background: trauma induces significant physiological changes that can lead to substantial morbidity and mortality. Methods: herein, we examined NK cell phenotypic maturation in trauma and non-trauma patients. Results: following trauma, peripheral NK cells were phenotypically less cytokine dominant, more mature, and cytotoxic. Discussion: this pattern suggests a widespread functional shift in NK cells activated by severe trauma away from the expression of receptors involved in recognizing stressed or damaged self cells. From the 2026 August 19 edition of Annals of Surgery. Background: carotid artery disease accounts for approximately 15% of ischemic strokes. Methods: in this single-center retrospective cohort study, 1,142 patients undergoing carotid revascularization were screened, of whom 500 patients met inclusion criteria. Results: among 1,000 carotid arteries, 732 were asymptomatic and 268 symptomatic. Discussion: CTA-derived quantitative and morphologic calcification characteristics are independently associated with carotid plaque symptomatology beyond stenosis severity, which may refine risk stratification in carotid artery disease. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 14 edition of Annals of Surgery. Background: this retrospective cohort study aimed to determine the incidence of persistent perineal sinus after proctectomy for Crohn's disease and to identify associated risk factors. Methods: all patients undergoing proctectomy for CD between 1993 and 2023 at a tertiary referral center were included. Results: among 139 patients, 66.2% were women, and PPS occurred in 26. Discussion: although PPS remains frequent after proctectomy for Crohn's disease, most patients ultimately achieve perineal healing. From the 2026 August 14 edition of Annals of Surgery. Background: ruptured abdominal aortic aneurysm remains a medical catastrophe. Methods: this nationwide cohort included Dutch RAAA repairs between 2014 and 2023. Results: of the 3642 patients, 15.2% were women, who were older and more often required open repair. Discussion: in this nationwide linked audit registry analysis, outcomes after RAAA repair improved substantially, despite lower estimated in-hospital turndown rates than in earlier eras. From the 2026 August 19 edition of Annals of Surgery. Background: these experiments test the feasibility of telerobotic surgery for the shipboard care of combat casualties. Methods: surgeons at 2 university hospitals separated by 1096 km bidirectionally performed remote cholecystectomy and right colectomy dissections on cadaver subjects. Results: network latency was 28 ms, jitter 0.03 ms, with 0 packet loss. Discussion: experienced robotic surgeons rapidly develop cognitive and motor adaptation to telerobotic latency. From the 2026 August 18 edition of Annals of Surgery. Background: to examine the association between the timing of surgical excision and survival in severely ill burn patients. Methods: this prospective, multi-center, observational cohort study included adults admitted within 72 hours of injury, with burns involving 20% TBSA across 6 French centers. Results: among 448 patients, 90 underwent early and 358 delayed excision. Discussion: early surgical excision within 48 hours was associated with lower adjusted 90-day mortality in adults with severe burns, supporting early excision as part of modern burn management strategies. That's it for now for ConferenceHype's coverage of the August 2026 issue of Annals of Surgery. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.